Wavical is an award-winning data and analytics company based in Chicago with a national presence. As a provider of award-winning cloud data, analytics, and AI solutions and services, Wavical combines deep technical expertise and industry knowledge with the proprietary automation tools to support the rapid shift to modern data architectures, real-time insights, and AI. Wavical Data Solutions is proud to grow through almost 100% referral. With solid delivery reputability, proudly leveraging the ability to meet clients where they are to unlock the power of data. Wavical Data Solutions.
Hello, I'm Dr. Beverly Wright, and welcome to Tag Data Talk. With us today, we have William Figueroa.
You got it.
Oh, did I get it?
That was it.
Oh, yeah. I'm looking for another vowel. Chief Information Technology Officer at Integrated Oncology Network. And we're talking about computer vision for health, living longer with AI, which is a topic that's very intriguing. A lot of people I know that are in healthcare are talking about some of the negative sides of AI, or even in other industries, and maybe job displacement and that sort of thing. And so it's refreshing to hear something that's super positive. So before we jump into it, tell us, why are you so cool, William?
Well, I like to think that I'm cool because I'm pretty athletic, snowboard, don't ski, mountain bike, cycle, surf. I'm from California. So all those sports are possible there.
Okay.
But really, in context of this, I've been in technology for 20 years. Been a data nerd for all of those 20 years. I love analysis. I love leveraging data to answer questions.
Me too.
Prove thesis statements. And I really feel like we're nowhere without it in technology because it's at the core of everything that we do.
Yeah. Amen to that. But do you pick a ball?
Oh, I've tried it. I've tried it and I'm okay at it. But for context, I lost to a 7-year-old. So
it can be like that.
Yeah. No,
yeah. Or a 70-year-old or, Yeah.
Oh, yeah. Yes.
Yeah.
And decided that I'd rather spectate and drink.
Yes, I understand. So we're talking about this computer vision for health and living longer with AI. And so let's think about this. When we talk about computer vision in the healthcare space, are we talking sort of like the clinical side? Are we talking like the operations side? Like, let's first, backdrop. What do we mean by that?
Well, we mean processing radio images.
Radio images. So
not in the surgical side, more on the clinical side as we assess patients in my case, an oncology scenario. Right? So lung images, lung MRI or CT images, colon screenings, breast cancer screenings, those kinds of things.
Okay. And walk us through a day in the life of like 5-10 years ago. What did this look like?
So 5-10 years ago, I wouldn't be in oncology, but I can tell you that the perspective that I see in our practitioners and our practices is that then it was very manual work, right? Scheduling was manual. The experience in patients actually almost the same, unfortunately. Meaning access to cancer care is almost the same. It's an experience that a lot more of us are having, but very few of us have any experience with. So healthcare is hard to navigate as it is. And when you're in a traumatic situation like cancer, it's even harder. So that's context. And I think that's an opportunity where we can use data to improve the life and outcome of a patient with cancer. But as far as we're concerned in the question, it's very much the same. You're diagnosed, you're referred to a place for your care. There's orders for imaging, depending on your cancer. And you're referred to a radio location where you go get an MRI, CT scan. And then that gets passed on to radiologists who then analyze images. And
a single person
that manages whatever number of caseload that they have.
Right.
And then they wait, and we get maybe 2 or 3 day turnarounds, maybe longer, to see those results.
Yeah. Meanwhile, sitting at home, stressed out, or trying to live your life or whatever.
Exactly.
So does computer vision put computer vision into that same scenario, if you would? Tell us how it's different now.
Well,
or could be.
It could be. It's emerging. So there are practices that are leveraging computer vision to accomplish 40% improvement in turn times. So radiologists are doing, maybe I can say there's 2 different ways to think about it. They can do 40% more work, meaning they can actually take on 40% more load and also reduce the turn times of these assessments, image assessments. So that's significant. But what's more important is anomaly detection with computer vision. So we're seeing studies that when a radiologist could miss a very small anomaly in an image, a computer can actually detect it and detect it in a situation significantly ahead of a cancer diagnosis. So think colon screenings or breast cancer screenings, mammograms. Sometimes we miss as humans, but that's where computers can help us detect those things very early and therefore have a significantly better outcome.
Yeah. So there's two ways to look at it. It sounds like you're saying that number one is there's a 40% increase in the number of cases, I think is what you call them.
Number of cases or images that can be processed by a single radiologist.
Gotcha. By a single radiologist. Okay, so that's huge. I mean, 40%. And then secondly is the accuracy, like you're able to detect certain things more often, if you will.
Yes.
Does the reverse hold true too? That like if they think they see something, but computer vision says, no, you don't see anything? Or is it always like it doesn't matter as much, right?
I think that's more of it's more of an approach.
Okay.
Right. So yes and no. I think the reality is that in those situations you do want humans involved.
Yeah.
And that's the exception process. So regardless of the analysis, the resulting analysis, the resulting analysis isn't just a circle around an image of what was found.
Right.
The recent technology in generative AI, the AI is actually adding words, sentences to their analysis.
Oh, wow.
I can't repeat them because I'm not a doctor.
Sure.
And I didn't memorize them here, but there is a description of what was discovered. And in most cases, that description, the note, is not changed by the radiologist. They either agree or disagree. And if they disagree, then they change it.
Right.
But in reality, if there is a detection and they don't agree, or a detection they do agree and something they would have missed, it is still positive.
Right.
So essentially, in a few cases that we've discovered, we found and detected these anomalies in colon screenings that could have resulted in significant cancer diagnosis that they waited for 2 more years, which is why the title of this, right? So if you find cancer early, you have a significantly better survival rate than if you catch it much later.
Yeah. Like in manufacturing, as an example, just to draw a parallel, there's porcelain products, and before they get glazed and go in a kiln, you can modify and melt them back down and rebuild it. And then, and sometimes there's a thumbprint or something really small that a human can't detect. Doesn't matter how many angles you have, how much light you shine, but computer vision can.
Right.
And so it can save the product, especially if it's something super expensive. But in this case, we're talking about people's bodies. This is humans. This could save them. So the two paths are, number one is the way more efficient, heavier caseloads per radiologist. And I may not use that term right, but images.
Yes.
And then number two is more accuracy and better detection early on. So does this just make it like what we're doing except better, or is this transformational?
This could be transformational, right? And especially in an industry where we're predicted to lose or be deficient 140,000 providers in the next 10 years.
Oh, wow.
So when you think about radiologists, oncologists, doctors, we're losing that resource, right? That resource to retirement, and we're not graduating enough of these providers over time. So to your point earlier, when you consider what AI can do for us, it's not so much, it does sound scary, sure, especially when we watch movies where the robots take over, right, Terminator. But there is a perspective here that it's more about augmenting our capabilities, using these technologies, and really being very responsible in how we're using them. And that's what can really become a launch pad for us as, I'll use the term as humans, because we can actually do and create more, right? Create better experiences for patients and do greater things as humans as well.
Well, sign me up. I'll take 2. I mean, so what's the barrier? I mean, you hinted on it just a little bit, I think, or hinted about it. But this sounds almost too good to be true. Like you've got a workforce that's disappearing. Right. You've got, presumably maybe even more sick people, especially with people aging and they're living longer and cancer happening like it does. And so where's the negative? Like what's the holdback? Is it funding? Is it culture? Is it data? Is it the tools?
It's a combination of all of those things, but I think the bigger one of those is really our ability to navigate regulation. In a lot of cases, some of these solutions aren't, they can be considered as medical devices, so they have to go through FDA approvals.
Oh.
That is not a significant hurdle, though. I think more of it is getting comfortable with the solution itself. And comfort comes to all of us when we feel like there's oversight. Right? The scariness of it, again, is that AI could take over, and real or not, I'm a skeptic. I think there's still a human constraint to AI because we're the ones building it. I haven't really seen anything that tells us that we're going to surpass that. So we're always going to have supervision of some kind. In this case, a radiologist is always going to receive the results, assess the results, and make their own interpretation. So that to me isn't scary. I think it's really more about the industry adopting more of this.
The industry.
And this becoming more mainstream.
So tell me about the parties. Like, who do we need to buy into this? Like, how much does a patient matter? Or is it going to be like, you know what, Henry, just let us do our thing. We're trying to take the best care possible. Or do you think patients are going to have a say? Or is this mostly regulation? Or is this the doctors? Like, what do you think?
Well, I think awareness is a big deal, right?
Yeah.
So all of us as consumers have to be aware of what's possible.
Like the literacy in general. Yeah.
Absolutely. And that's also where AI can help us. I like to think of this opportunity in creating a better human experience. And that is what we need to start leveraging. How do we actually humanize the world that we're in as technologists so that we can expose more information to the patient, especially as they enter a diagnosis, and be specific to what they're dealing with. If they're dealing with prostate cancer, breast cancer, whatever that might be. And ensure that they understand how to navigate within their own healthcare system, right? And inside of their provider, their insurance provider, and what their capabilities are. And I like to think about it that way because, unfortunately, I wasn't diagnosed. My sister was diagnosed with leukemia, and it took a whole army of family to do research, understand what was possible, and then challenge our doctors to find the best path forward.
Wow.
And that was a significant effort. I mean, you're talking me on airplane rides doing research instead of working, right? Staying up late nights. And that is what's been near and dear to my heart, is how do I then take everything that I understood to create the ability to navigate this, and then synthesize it into something that's consumable for everyone.
Right.
Right. Especially maybe not, as a general education for cancer awareness and how to navigate a healthcare system, but more in the moment when you get your first diagnosis, quickly educate them on what's available. And if something isn't a direct path to the real care that they need to survive this, then find alternate paths, right? Alternative paths like clinical research studies or anything that may help give them another chance at survival.
Right. I got you. And this is tricky. I mean, this, not any one health system or doctor or individual or technician is responsible for AI literacy. I was talking to a dear colleague and friend, and she was talking about how when you're afflicted with something like cancer, like you can't even think straight. And to have to, this particular person is a fighter. I mean, she will fight. And it shouldn't take that, right? It shouldn't take all that fighting to, kind of get the answer, right?
I'd be a wimp in that situation.
You can't be a wimp. You can't be a wimp.
I would be. I'm thinking about my sister.
Yeah.
It's like, well, how are you so strong? I thought I was a strong one. But no, I'm totally with you. The reality is that in that situation, we've got to synthesize it. Reduce it to its most understandable core, right? We can't say AI literacy to anyone that's being introduced into this situation.
I mean, computer vision, they might think it's like these robots and lasers and, how do we, is this on the schools? Is this like how do we improve on this?
Well, I don't have a clear answer to that.
Yeah.
But what I do know is that no different than it's our historical experiences, no different than the first time we opened a computer, right? And you got the phone call from someone saying, how do I do this?
Right.
It really is more about awareness of capability, awareness of data, and it's actually maybe it's more intuitive. Maybe maybe I do have an answer. Maybe it's repurposing what we do today with our phones, right? Instead of it being a social media app that we open, maybe it's a different approach to engage them, and maybe it's on both our providers and the healthcare systems. Because I have a healthcare app on my phone. I open it to set up appointments, right? Do those kinds of things. And maybe it's in context of that interaction, right? That level of engagement where, hey, we're doing proactive work as you go into, let's say, my yearly physical, and I go into a prostate screening, hey, here's what to expect. If you do get a diagnosis, here are the next steps, right? Instead of, because that is the first opportunity. Yeah. And the contrast there is that, and this is another topic that maybe we can talk about at some other point, but I do feel like our superpowers as technologists have been leveraged in a way that is not conducive to our the best human experience, right? In social media and engagement and marketing there. Yeah. So the real question, really, the thing I'm challenging everyone to do is to rethink how we've approached technology and engagement, and repurpose that to serve us in better ways.
I love that. Oh, that's fantastic. I mean, I have a friend who still won't use an air fryer, because she's worried about things. But I sort of look at this.
Maybe not that extreme.
I mean, really, I look at this kind of like when what it must have been like when people moved from horses to vehicles. Now you've got an engine. Most people don't understand exactly how a vehicle works. Like, it's small explosions. That's all I know. And that sounds kind of scary compared to, Chip the horse. So I would imagine that people kind of feel this way. So that brings up one of our last questions, which is the ethical side. And we could talk a long time about this, but the one dimension I kind of want to explore just a tad is it unethical not to use computer vision when you could do things better? Or is it unethical, to use something that's so important with people? I mean, there's that debate, right? Like, where does it stand?
That is a good way to pose the question.
Yeah.
If we have the capability, why not use it?
Right.
I agree. I agree with the question and the underlying message there. I think it's unethical to not use
something at your disposal,
right? Especially to save a life or to avoid a situation. And that's probably the other paradigm shift we have to take in healthcare is stop treating episodes of care or reacting to those episodes of care. Instead, start proactively managing care. And I think that's the other area that we can actually leverage AI to do, right? To help us do.